One of the really important benefits from patientrack that I wasn't really aware that was going to happen was when that initial trigger goes off, the nurse in charge of the ward often didn't know that patients were getting sick, and there's a really obvious and useful learning experience that's occurring here now. So a nurse in charge will go to that patient bedside straight away and talk to the nurse, and they'll find out and together be able to look at how they can improve that patient outcome. And that's meaning we're seeing a lot more of patients being able to get down from adjusting a trigger to better by that nurse interaction, rather than it having to deteriorate and get a medical response. And that's been something that was not really expected, but a really clear, obvious improvement to the patients.
I think patientrack is a really innovative system which is really looking to try and help solve some of the very long-standing problems that have always been present in hospitals. And I think by bringing patientrack in, not only are you forcing people who are sick to be seen sooner, which is absolutely the intention, but there's all sorts of ramifications in terms of recognising weaknesses within your own system and then being able to deal with them, and also being able to focus on acute illness and training and making sure your staff are up to date, all of which has benefits.
Another benefit that we've seen is that the senior doctors get to know about the sickness of their patients. This didn't always happen before. There were times when the escalation didn't get up to that level because people felt they could cope, or they didn't need to refer on, or they just didn't want to disturb their senior doctors. Now this is meaning that they haven't got that option. It automatically escalates, and that is really clearly important. So the right people are coming to the bedside, so it's benefiting patients and it's benefiting more junior medical and nursing staff, ensuring the right person gets to the right bedside all the time.
The response from the clinicians who are coming is increasingly more mature, and they now recognise that actually all they're doing is coming to see a patient that they would have seen, but they're catching them earlier in their illness. So is that its chart?
Yeah, have you seen her?
Yeah, she looks there. The best thing about it would probably be the fact that from where we were, trying to get clinicians to come to see patients, this works because it gets people